Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you know, this is a webinar where we're going to discuss Lyme disease. I look forward to seeing what you have in store for me tonight. I see a number of familiar names on my message board, but I also see a lot of new names here tonight as well, too. So for those of you that are returning, I'm glad to see you're here. I think you're probably getting value, which is why you're returning. And for those of you that are new, good for you. Good for taking a chance on your health here tonight. The way that you can participate in these webinars, there's two ways. First thing you can do is actually see what questions other people ask, and then how I respond to those. All right. And if you're in the live version, you actually get to see those questions on your screen. They actually show up on the bottom of your screen. If you were in the recorded version, though, you're going to wind up having to listen to me read the question. So yes, I'll read each of these questions out loud. The second way that you can participate is to actually go bold and write a question. The way you do that is there's a chat box over on the right-hand side of the screen at the bottom, and you can write your question to me there. The thing I ask about when you do that is try to be shorter with your questions, really detailed histories. Don't work in this type of a forum, okay? And secondly, when you're writing your question, do not hit the enter key to create paragraphs. Every time you hit the enter key, it actually sends a separate question by direction. So just write your question as a run-on paragraph, okay? And I'm okay with that. The other thing I want to let everyone know, I am creating a recording tonight, just like I do each week, and usually that works out. So if everything goes as planned, I will write a synopsis up about what we talked about tonight and get an edited version of the video out to you tomorrow, somewhere hopefully by 9 to 9:30 a.m. Central Standard Time, or Austin, Texas time, as I like to say. All right. So take a look at that. And then in that email tomorrow morning, you'll have an opportunity to sign up for next week's webinar. We will have another one next week. The week after that, I'm off because I'm going to be out at the ILADS, the International Lyme Associated Diseases Society annual meeting in Boston. So I won't be able to give you a webinar that week, but the week after I will. So we've got tonight, next week, a week off, and then we're back at it again. Okay. All right. And then one other thing I asked tomorrow morning, when you get that email, share it with other people. Let people know the good work we're doing here. And if you're getting benefit, others will get it too. So I hope you'll join me in my mission to help as many people as I possibly can living with these disorders. All right. All right. So without any further ado, let's go ahead and get started here. Hello, Doug. Let's see. Hi, Dr. Ross. A few questions. I have Lyme, Bart, and mold toxicity. As to treatment, I'm at month 3 for Lyme, month 1 for Bart, month 6 for mold toxicity. I use benzodiazepenes for anxiety and sleep. I've heard that benzos can cause withdrawal type symptoms during times of the day when you're off them, and that they can aggravate Lyme symptoms. Do you have a view? 2, do you know what can relieve head pressure? I tried Diamox, which helped but gave me severe acid reflux. 3, what do you suggest to keep yeast at bay during Lyme treatment once the overgrowth is under control? Thank you so much. All right. So regarding the benzos, most of the benzodiazepines, it depends on which benzodiazepine you're using. All right. So for instance, there's the benzodiazepines, everyone, are the medicines. They're the Valium family of medicines. Okay. So in that family are things like Valium, also known as diazepam. There is a lorazepam. There is, which is also known as Ativan. And then there is Restoril, which is a sleep medicine, okay? Now, all of these benzodiazepines have different, what we call elimination half-lives. So the amount of time that they take to get out of your system. So for instance, there's one that's called clonazepam, also known as Klonopin, that may take up to like 2 or 3 days to completely get out of your system once you take it. The short-acting sleep medicine like Restoril, that has, I think, a half-life of maybe 2 or 3 hours, something like that. And that's going to get out of your system, and you could potentially go through withdrawal. The medicines like a lorazepam that have a half-life, I think it's about 8 hours. I might have to look that up. granted, they're going to start wearing off, but they're not out of your system in the middle of the day completely. Okay. So it is possible you could go through some withdrawal symptoms if you're using one of the ultra short acting ones, like the ones we use that are designated as sleep medicines, like a Restoril. But if it's an Ativan or lorazepam, and definitely if it's a clonazepam, Klonopin, they may just be still in your system enough to keep you from going through withdrawal in the middle of the day. Okay. So it all depends on which ones you're on, basically. And then your second question, the head pressure, that type of head pressure you're describing, a feeling of pressure in your head, I found in my practice to be a symptom that is often seen in Bartonella. Or when it's there, I should say, it's often due to Bartonella. So it is likely the longer you're on your Bartonella treatment, as you get Bartonella under control, that symptom should start going away. Sometimes the Diamox is a diuretic, everyone, that can help you pee out water, and therefore that decreases the water content to the brain, which decreases pressure. Sometimes that can help, but not all the time. All right. Beyond the Diamox, I don't have a good idea for you. The main thing would be is get your Bartonella under control. The other idea is obviously to lower the inflammation that we see associated with mold toxicity, Lyme, and Bartonella, and that's inflammation due to a group of chemicals called cytokines. And I think you're familiar with that. But what lowers cytokines that I like to use is to use curcumin phytosome. Curcumin is a component of turmeric, the Indian seasoning turmeric, and it gets inside of white blood cells and limits their production of inflammatory chemicals called cytokines. And so that can sometimes be helpful too. And that's 500 milligrams of thorn curcumin phytosome, one pill 3 times a day. Now, looking outside of drug therapy or herbal medicine therapy, sometimes I have seen people get relief doing acupuncture. Sometimes I have seen people get relief with the head pressure doing a type of osteopathic medicine, I'll call manipulation, where they called cranial sacral therapy. And with that, if you can find somebody trained in that, usually it's either going to be osteopathic physicians, medical doctors like myself that took training in it, or sometimes physical therapists will know how to do it too. It's called craniosacral therapy. Okay. So sometimes that can give you relief for it as well too. Okay. All right. And then let's see. What do you suggest to keep yeast at bay during Lyme treatment? So in my Lyme disease treatments and in my Ross Lyme support protocol, one of the things I suggest is figure out if you have too many yeast at the beginning of treatment. And if you do, go on some stronger antifungals to keep it under or to knock it out. But once you've got it out, the way that you control it from coming back while you're on herbal antibiotics or even prescription antibiotics is you want to make sure that you're taking probiotics. And these days, I like having people take probiotics that have 2, I call them general categories of bacteria in them. So their probiotics are made up of bacteria, right? And there's a type of probiotics that are made up of strains of bacteria that normally live in our intestines. We call those human strains. So that would be things like Lactobacillus acidophilus, Lactobacillus bifidum, Bifidobacterium. Those are things that you would think of as being human strains, okay? And then there are also a type of probiotics which are called soil-based, or also known as spore-forming probiotics. And those are things like Bacteroides. Those are useful also. They work in a different way. They're more of a supporter. They help support our normal bacteria that live in the intestines to work better. And they also support those human strains that we take to get into our intestines and to get set up there, okay? So a product that is made up of both human and these soil-based or spore-based strains is a product called, by research nutritionals, called Multibiome. It has both these general classes in it, and I usually have people take 1 or 2 of those pills once a day. Or if you happen to have something that has human strains in it already, you can add a product that is just the spore-forming strains. And Research Nutritionals has a product called Probiotic that is a spore-forming, and that's 2 pills 1 time a day. And I would take that in addition to your human strain probiotic as well too. Okay, I'll do a screen share here in a minute, and I'll show you those. Okay, and then the other thing I'll do is I will have people stay on, if they were on it as part of their yeast treatment, I'll have them remain on nystatin. And that's 2 pills twice a day, which is a prescription. Or if you don't want to do the prescription, you could use an herbal product. And I like using these days a product called Capri Plus. That's CAPRI+, by a company called Karuna. And that's Karuna with a K. And that is 2 pills twice a day. That's a product that has some garlic in it, some caprylic acid in it, and some oregano oil in it too. And it can be useful at helping to prevent yeast overgrowth. All right. So let me just do a quick screen share here. I'll show you a few of these products I mentioned. All right, so this is my supplement store, Marty Ross MD Supplements. And as most of you know, anyone can purchase from here. These are the products that I have used with my own patients when I was practicing in Seattle, so I know they work. I have curated all of these products here, looking for companies that have the best chance of giving you great active ingredients and that don't put a lot of artificial garbage in there. All right, so these are tested by me. I mean, meaning that I've tried them on patients. I know they work. And the brands I've selected are really good. If you choose to order from me, there's a number of advantages. 1, I offer at the lowest prices the manufacturers allow. 2, I try to reduce your cost by covering your taxes. And I offer free shipping if your total order is over $50. So there's benefits in ordering here too. So in terms of that Capri Plus, so product by Karuna. And I like this product. It does a nice job. And then in terms of the probiotics, actually, I think we can just look under here. Probiotics. There we go. So the human strain that I talked about is this product called HMF Forte. The spore forming could be either a corebiotic or a corebiotic sensitive. And then this product that has everything in it is multi-biome by Research Nutritionals. Okay. All right. All right. Doug, good luck to you. Thank you for that question. Or those questions, I should say. Hello, Kathy. Let's see. I'm wondering about the possibility of Lyme being the cause of the pain in my sinuses or teeth area on one side of my face. For several years, the ENT says my sinuses are fine. CT scan verified, and the dentist says my teeth are fine. X-ray, cone beam scan verified. I had cavitation surgery several years ago and the metal replaced with zirconium on the side that hurts. A full body thermogram lit up my sinus area, but the ENT says that it is meaningless. A vibrant test in 2021 said I have IgG for Borrelia and Babesia and IgM for Bartonella. An IGeneX test in 2017 said I have active Babesia decani and IgG Western blot positive with 6 bands, but not CDC by IGeneX. I tried several herbal treatments, but had to stop due to herx. Is it possible the spirochetes have taken residence in my sinuses or mouth, which caused me pain on and off? I can have pain for several weeks, and then things are fine for a few months. When it is active, it feels like I have serious sinus infection, congestion. So, unfortunately, I don't think I'm going to have a good answer for you here. I haven't seen, so I would say that sinus pain is not a common symptom that we see in tick-borne infections. And I say that, so no one has, there's no studies done that show that it's part of that. In other words, that is not one that we see on a common list of things that people report. I also can say that from having managed, thousands of patients with chronic Lyme disease since 2004 until I stopped practicing earlier this year. And I just didn't see that as a predominant symptom. Now, that's not to say it's not happening in you that way, but if you want to know, is this something that we see? The answer is no. I would say we don't see that. The one thing, so it would be great if I could ask you questions. I would want to know if you're having a lot of postnasal drip, if you're having a lot of discharge into the back of your throat and you're having to cough that stuff up periodically. If so, one of the things that can lead to regular irritation of the sinuses, not just like pain usually, but if you happen to have developed too many yeast in your intestines, that it is not uncommon to get nasal congestion and postnasal drip as part of that. And if that builds up enough in your sinuses, that could leave pressure. Usually that's going to be seen on a CAT scan. They're going to be able to tell that you got a lot of mucus in your sinuses, but not always. And so that might be something to think about. The other thing is if you've had a lot of antibiotics, it is a cause of sinus infection, can sometimes be yeast as well too. The way that it happens, though, if it's in your intestines, is when there's too many yeast in the intestines have a lot of immune cells that line them, and there's a group of immune cells that line the intestines called mast cells, and that's where your histamines are made. If those mast cells see yeast, they're going to manufacture a lot of histamines. They're going to get into your bloodstream. They're going to go up to the sinuses, and they're going to lead to some inflammation up there, but also they can lead to some of this postnasal drip that I'm telling you about, okay? So you might want to look at my article about how do you diagnose if you have chronic yeast overgrowth in your intestines. I'll show you a link on that here in a minute. And if you think you do, based on looking at that article, you might want to do a course of trying to treat for chronic yeast and see if that makes a difference for you. Okay? All right. Let me just do a quick screen share here for you. All right, so take a look in my online Lyme guide and take a look in this chapter called Yeast and look at, is it a silent problem? Is it yeast? Okay, and that and gives you information about how do you figure out if you have too many yeast living in you. Okay, all right. All right. Very good. Good luck to you, Kathy. All right. Let's see here. Hello, Colleen. Hi, Dr. Ross. What's your opinion of the GI 360 stool test from Doctor's Data and Regeneris Lab? Also, what's your opinion of the urine organic acid test, and does it matter which lab you use for this test? Thank you for everything. So I'm not familiar with the specific GI panel from Doctor's Data, so I can't make a comment on that. In terms of urine organic acids, there's a theory that different organic acids, whether they're elevated in your urine or not, can indicate certain illnesses. And, I've studied that for some time, but I just don't find it to be valid. And frankly, the data supporting that has not really been adequately validated either. So I have looked at using organic acids to help me determine things in my practice before, but I didn't find the results to give me reliable, addressing the results did not give me reliable improvements in my patients, basically. So I'm not, and then when I looked at the science on it, I don't see that there's adequate validation of organic acid testing to truly indicate illness or to manage illness as well too. All right. So there you go. That's my opinion on it. Okay. Thanks for the question, Colleen. Hello, Maria. Let's see. My daughter is 12 and testing her for Lyme and co-infections with hygienics. Waiting for results, and her doctor is doing a provocation. Last time you mentioned to me also check for yeast overgrowth, so getting her tested with Mosaic Diagnostics with the MOAT test. I think the MOAT is an organic acid test for microbes. Okay, and so I'll say more, but no, I don't think that's even useful for yeast, and I just don't. So your doctor may be doing it, but the studies that look at the organic acids produced by yeast are not reliable indicators of whether you have yeast or not. I've gone back and looked at that too. So anyway, I'm sorry. I wouldn't use that as a way of looking to see if you have yeast. Could it be a virus or maybe from the COVID vaccine? Trying to get all the tests possible done since we are dealing with this for 2 years. Thank you so much for all your help. You give everyone. Always looking forward to your webinars. So COVID and long COVID, and sometimes after the vaccine, people do get syndromes that can look like Lyme. So the answer is maybe. I can't remember all of your daughter's specific symptoms from last time, so I'm sorry. I'm kind of shooting from without that information in mind. Okay. So anyhow, I can't say for sure. What I can tell you is I don't rely on organic acid testing. I don't rely on stool testing for yeast, because what you're really interested, so the stool may show you if you have yeast or not. Everyone has yeast in your stool. So even when it doesn't show up in your stool test, you have some, okay? But the issue is with yeast, and the reason that stool testing doesn't work, like measuring amounts of yeast, is what you're really interested in is for you, or in this case, your daughter, is it a relative excess? So is it more than is usual in her intestines? And it may still fall in a normal range, and sometimes they won't even detect it. So what I like using is a yeast screening questionnaire, and that I have found to be reliable. And basically on this questionnaire, it looks at what are your risk factors for getting too many yeast, what are symptoms that indicate too many yeast, and how intense are they? All right. And if you score it and you score over 140, I have found great benefit in treating for intestinal yeast. All right. Now, does that screening tool prove it's yeast? No, but I hope you heard how I just said it. I said when it's over 140, I find great benefit in treating for intestinal yeast. I usually see people have a lot of improvement by doing that. Okay. So I would not rely on organic acid testing for yeast. It's not validated. There's other things that can trigger a number of those organic acids to be up, down, or up, not related to the illness. And so, that's my opinion on it, right? Let me just do a quick screen share. Oh, so I actually did that screen share earlier. So take a look. I had the previous question. I showed you the yeast chapter in that article called a Silent Problem, Could It Be Yeast? If you read through that, you'll find the questionnaire. I have a link to the questionnaire. And again, if you score over 140 on that, high probability of yeast, and that treating for yeast will make a difference. Okay. All right. Good luck. Oops. Let's see. Hi, Sonia. I don't see a question there. Let me see if I can find one, though. Oh, there we are. Let's see. I'm wondering if you could tell me what you use to put me on for systemic candida. I have an appointment, so I'll have to watch it later. Thanks, Sonia. All right. So I think Sonia is a person that used to be a patient of mine. So to answer her question, so first of all, I want everyone to know when people use that term systemic candida, that does not mean that the yeast are living throughout your body. All right. And they don't. All right. If you had actually yeast living in your bloodstream, you would probably be dead. I mean, that's how severe of an illness it would be. What happens, though, when you have too many yeast living in your intestines is they trigger your immune system manufacture excess cytokines. And as many of you know from my previous webinars, if you've been here, I've discussed cytokines before, but the quick idea on cytokines is cytokines are made when your immune system sees a toxin, COVID, yeast, tick-borne infections, etc. Right? And they're good. They help your immune system work better. But if the immune system is having a hard time dealing with these problems, it'll start making too many cytokines. And too many cytokines give you sleep disturbance, body pain, make it so you can't think, give you fatigue, make you hurt all over, give you joint pain, interfere with how your hormones function, etc. So those are what we call Lyme symptoms, right? But what we call Lyme symptoms are really excess cytokine symptoms. And when you have too many yeast in your intestines, they trigger something very similar because they trigger too many cytokines to be made too. And the cytokine symptoms go systemic, not the yeast itself, but the cytokine symptoms go systemic. Okay. All right. So, Sonia, I don't know. If I would be glad to help look at that. If you would remind me by writing me a short email about this, and that my email you could write to is docmarty, is DOCMARTY at martyrossmd.com. All right. Now that's for Sonia to use, everyone. I don't want the rest of you flooding me with a bunch of questions there. Okay. But Sonia, feel free to do that. And that will remind me to take a look into your medical record to see if I can figure that out. Okay. All right. So good luck to you, Sonia. Hello, Mosby. Let's see. Is it Lyme or Bart that likes to be in the skin layers and burns? I feel like the skin around my face is always burning. Thanks. So either Lyme or Bartonella can cause injury to the small nerves in your skin. And when nerves get injured, one of the symptoms they can have is burning sensations. Other symptoms they could have is you get numbness or tingling, but burning sensations is a common thing that indicates small nerve fiber injury. Okay. And so it could be either one. Could be either one of those, Mosby. All right. Thanks for that question. Good luck. Hello, Maria. Let's see. My daughter is 12 and testing her for Lyme and co-infections with hygienic. Oops, we answered that earlier. Hello, T. Hold on here just a minute, T. Let's see here. Dear Dr. Ross, I treated chronic Borrelia and with Otoba and cat's claw only, and I greatly improved memory, seizures, and fasciculations. But I continued with crippling fatigue, sleep disorders, slowness to think, introduced Hootenea, assuming Bartonella. In 7 months, I managed to reach 10 drops twice a day, but I had the worst neurologic reactions of Herx since the first drops of Hootenea. I couldn't take it. I stopped Hootenea. I'm still using cat's claw and Otoba, and the acute neuropsychiatric reactions disappeared, but skin reactions such as papules, migratory erythemas, I never had them. Lots of livedos and small stretch marks appeared. What happened? Did Bartonella replicate again with the decline of Hootenea, or has Borrelia been reactivated? I seem to have gotten worse after I started treating Bartonella. Should I treat her? In recent years, I also developed autoimmune encephalitis. Could treating Bartonella ease the autoimmune encephalitis? Appreciate your help. Your book was wonderful. T, I'm gonna have a hard time answering your question. I would need to ask you a lot of questions about your symptoms before Hootenea, after Hootenea. You've given me a lot of detail here, but I would need a lot more detail. So I don't know. All right. It is possible that Lyme and or Bartonella both can trigger autoimmune encephalitis. It is possible the bad reaction you had was either Herx or initially was Herx or was side effect of the Hootenea. I can't tell in this kind of form, and I can't ask you enough back and forth questions to figure out the best answer for you here, unfortunately. I would suggest that you look at, I'm not sure if you can find somebody, but you could find a Lyme literate practitioner to sit down and look at all this with you. I think that would be helpful because they can do the question and answering with you then too. Okay. All right. Good luck to you. Let's see. Hi, Clemma. For some reason, my eyes were saying, I thought that was an I. I was going to call you Siema, but it's Clemma. Let's see. Hi, I'm an MD in Wisconsin. Hello, glad you're here. Let's see. I just started to treat chronic Lyme. Glad you're here. I'm glad that you're willing to jump in and help with this. A 15-year-old patient with fatigue, arthralgias, and headaches, with continued positive IgM 2 bands and not improvement with symptoms with doxy for 6 weeks. Cryptolepis, Japanese knotweed, and skullcap from Lyme core. Can't afford Igenix. Also has positive mycotoxin test and is on binders. I shifted to minocycline and contemplating what to add. Any thoughts? All right. So one thing I want to let you know. So in terms of there being a reliable test to indicate if your treatment for Lyme or even treatment for Bartonella or even treatment for Babesia is working, there is none, okay? Antibodies, which your bands, the IgM antibodies, we know that in chronic Lyme, based on research that was done by National Institutes of Health, so NIH about 20 years ago now, conducted 3 or 4 different laboratory studies or clinical studies looking to see if using antibiotics long-term in people that had previously failed treatment would make a difference. And in their trying to enroll people in their various studies, they had everyone do Western blot test to see if they would qualify as having Lyme disease. And in looking at the enrollment data, they found that about 50% of people that had already been treated and were still having chronic symptoms maintained positive IgMs. All right. And so IgMs don't necessarily go away in chronic Lyme, even if you've been treated. IgGs, obviously, as you know, IgGs may not go away. And so there is, unfortunately, we don't have reliable testing that proves we're done. Now, there's some other ways of testing that may give us benefit, but I think it's too early to tell. There's phage testing that's done by Red Labs, where you can measure the amount of viruses that are seen in the body along the time that they actually have Lyme. And in theory, if Lyme is getting better, the positivity and amount of your phage testing for Lyme should improve. But that's still early. We don't have a lot of validation there. If your patient had an ELISpot test done, which is a T-cell reaction test, in theory, T cells will live in you for about 2 months. They circulate for 2 months and they die. So if you're measuring T cell reactivity and at the beginning it's positive and then later in the treatment it goes negative, that could mean that your person is getting better. However, the T cell testing that's done here in the United States through InfectoLab is only measuring for T cell reaction against Borrelia and Bartonella. It does not look at the European strains, which we're starting to see in increasing amounts on the East Coast and even getting into the upper Midwest. Okay, so that would be like Afzeli and Guarini. So that's not useful either. And also, there's no one's validated to say if your ELISpot becomes negative, does that mean your germ load is gone? It could just, keep in mind that as Lyme suppresses immune system, and it's possible it could periodically suppress it in a way that you don't even get T cell reactions to. So what I want you to know is at this point in time, we don't have a valid way of seeing if a person is getting well. And it is unreliable to look at your IgMs as a means, or even IgGs and band levels and intensity reaction, et cetera, to see if somebody's getting better. The best we can do is look at what their symptoms tell us. Okay. So I just want you to know that. Okay. All right. And then let's see. So your patient had fatigue, body pains, and headaches, and no improvement on 6 weeks of doxy. I believe they were also on cryptolepis and knotweed and skullcap. Can't afford it. He has positive mycotoxin tests and is on binders. So I would want to know, based on symptoms, whether they have enough symptoms that suggest Babesia to me and enough symptoms that suggest Bartonella to me, and use that as a guide as to whether I need to beef up those parts of the treatment. Now, granted, your cryptolepis and knotweed should be taking care of both a growing and persister Bartonella, growing and persister Lyme, but they don't necessarily always work. All right. So I would be thinking, if you're 6 weeks in and you're getting nowhere with the herbs and the doxy, it is time to change. I agree with that. I like the fact you changed over to minnow. Sometimes that's going to work better than doxy, but you also then need to determine, is there Babesia here and is there Bartonella here? So key symptoms to look at that might help you determine if there is Babesia would be to look at, are there night sweats? Are there panic attacks? Do they have a lot of POTS type symptoms? So racing or skipping of the heart, getting dizzy easy when standing up, having a lot of frontal headaches, or having a lot of migraines, having air hunger. Those would be things that I would be looking at. And if there's enough of those that are positive, I would wonder about the possibility of Babesia. Okay. If in terms of looking at whether there might be Bartonella there, and I know you're not getting testing, but you can rely on symptoms too. Bartonella, things that indicate to us Bartonella tend to be foot pain on the soles of the feet, having a very agitated nervous system, which could look like anxiety, just ongoing anxiety, versus Babesia. I forgot to mention, Babesia will give you panic attacks. Ongoing anxiety, pervasive anxiety that's with you all the time, tends to be more of a Bartonella symptom. Other signs of agitation could be muscle fasciculations, can be having seizures, having tremors, having shakes. Bartonella also can give a lot of neuropsych, so the anxiety I already said, but also you can get a lot of depression with it as well too. Other things that indicate Bartonella can sometimes be air hunger, just like Babesia can, and then having stretch marks. And if you have enough of those, then you want to bolster up the Bartonella part of your treatment. Okay, so ways that you could bolster a Bartonella part of your treatment. You could keep up with that minocycline, which gets at intracellular growing Bartonella, and then to treat intracellular Bartonella, both persister and growing forms, diflucan. So the azoles, according to Hopkins research a few years ago, they looked at clotrimazole, and or they looked at a representative of each major antimicrobial family in the lab, trying to determine what would work best on growing and persister Bart. And they did study clotrimazole, and they found it's really quite effective. A year and a half ago, knowing that, I started working with fluconazole in my practice and found it to be pretty effective at helping people move their Bartonella forward. Okay. The other advantage of using it is azoles like metronidazole, tinidazole are useful anti-cyst agents for Lyme. So with your Lyme, your minocycline is covering spirochete, and your fluconazole could help out with, minocycline is treating spirochete and intracellular Lyme, growing Lyme, and your fluconazole could pick up growing cyst. Okay. For Lyme, you still are going to need to do something else for persisters, you might look at using a cinnamon clove oregano capsule, 1 capsule twice a day on that. That would pick up your persisters and even some of the growing form too. And then if Babesia is present based on symptoms, you might look at adding in Malarone. Malarone with minocycline is a pretty effective Babesia treatment as well. All right. And if you do these other additions that I just mentioned, you would not need the crypto and the knotweed or even skullcap, because the cinnamon clove oregano is going to handle a lot of the persisters for you, and the pharmaceuticals are going to give you a stronger way forward, I think, in terms of Babesia or Bartonella if they're present. Okay. All right. So I hope that gave you some things to think about. If you have more questions, feel free to reach out to me through email. And I'd even be glad to share you my cell phone number if you want to talk directly about this too. My email again is docmarty, DOCMARTY at martyrossmd.com. Okay. All right. Nice to meet you, and good luck to you. Good luck to your patient too. Hello, Chris. Could someone who has tick-borne diseases, let's see, there's got to be more here. Let's see, Chris. Could someone with chronic tick-borne disease, Lyme, Babs, and had a bad case of COVID 1 year ago benefit from taking Maraviroc? So there is a physician named Dr. Bruce Paterson that during COVID, and still to this day, developed a theory that people with long COVID syndrome, he could identify them doing a testing for a certain pattern of cytokines. Okay, so it's a cytokine fingerprint, if you will. So cytokines, I mentioned that earlier tonight. I just want you to know there's a variety of cytokines, all right? And in his theory is that there are certain cytokines that will be elevated that can indicate that you have long COVID. And he also, as part of that, developed a theory that there are certain cytokines that would be elevated that can indicate chronic Lyme. Okay. All right. Now, in his protocol to handle long COVID, he would have people take a statin. These are the kind of classes of medicines that we usually use to treat cholesterol, but they can be anti-inflammatory, anti-cytokine. He would have them take a statin along with an HIV antiviral medicine called Maraviroc. All right. And he, in theory, he believes he has science that showed that this would help with long COVID. He also believes, based on his science, that people that have long Lyme, that have that certain cytokine pattern, would also benefit from Maraviroc, as well as using the statin medication as well too. All right. Now, he's got research that supports this, but it's research he conducted. And it has not been independently recreated to know if it's valid. What I can share with you is that in the patients that I referred to him and to his system, both long Lyme, long COVID, I just have not seen good results. There are people out there that do report good results, but on the people that I sent to him, I haven't seen good results. So what I would say is maybe it would benefit you. The data is not clear. We have data from one scientist that says it will, but it's pretty biased data. It's stuff he did himself. Okay. So it's hard to say. All right. Thanks for that question. Hello, Joe. Let's see. Have you heard of anyone who has severe skin pain due to Lyme and 2 co-infections? Nothing relieves the pain. which also affects my shoulder. Test showed nothing is wrong with the shoulder joint. A biopsy of the skin, which does break out in a rash at times, but it was an inflammatory response to something. So it depends on the quality of the pain. So typically neurologic pain is going to be burning if it's due to injured nerves, but also sometimes neurologic pain can have the following qualities. It's going to be sharp, stabbing, shooting, burning, ache, is intense aching. It's of a different kind of quality of aching. It's a more intense quality of aching than if you've got inflammation in a joint or inflammation in a muscle. It's very intense. So it depends more on what the nature of the pain is. If it's neurologic pain, having those qualities that I just said, then yeah, Lyme and Bartonella can lead to nerve injury that can give you those kinds of pain. So I have had people with severe burning pain. I have not had people with skin boring or intense pain. So I haven't seen it, but usually the kind of pain I've seen, this neurologic injury that leaves a severe skin pain, would be a burning kind of quality. Okay. And yes, that can be seen in chronic Lyme and in chronic Bartonella. So in terms of things that can work with that kind of pain, get your infections under control if they're there. If it's toxins that are injuring your nerve, remove those toxins. And then there are things you can do to regulate nerve pain. They involve a number of things. One, getting inflammation down. So I like using the curcumin phytosome for that, 500 milligrams 3 times a day. They also involve interfering with the nerve transmission of that pain at the level of the brain. So anti-seizure medicines like gabapentin can help. Lyrica, which is an anti-seizure medicine, can help. Certain anti-depression medicines can help with that. There's an herb called L-theanine. L-theanine is a chemical found in green tea. It's not caffeine. And that is converted into a chemical in the brain called GABA. And if you give more GABA to the brain, it binds to what are known as GABA receptors. And GABA receptors can interfere with pain transmission as well, too. All right. So those are some things to think about. And you should talk to your doctor about that, though. Okay. All right. Good luck to you. Hello, Anna. Let's see. Sinus and tooth. Oh, we already got that earlier, I believe. Oh, wait a minute. I think this is a different question than earlier. So let's see. Hi, Anna. Let's see. Sinus and tooth pain. I've also had this for years. ENT negative. No metal fillings, only minor white fillings, but had wisdom teeth out. Also, jaw pain, neck pain, base of skull, positive for Lyme, and 2 rickettsial infections on Hygienics. Clinically positive for Babesia, classic drenching, night sweats, Bartonella. Not sure about yeast, but I don't think so. I will read through the article, though. Oh, okay, got it. You're responding to you did. This is your question from earlier. I got it, Anna. Thank you. Yeah, see what you can see from that paper. The other thing or from the yeast section. The other thing I'll let you know is Bartonella and Lyme can give neurologic pain. So if nothing shows up from the yeast standpoint, you continue having sinus pain, it is possible, although it's nothing I've seen, it is possible that neurologic injury around the sinuses could lead to that pain. And it is possible that Lyme and Bartonella could do that. My comments earlier, though, is I haven't seen that. Okay, I'm saying, so what I know is in theory it could, but I haven't seen that happen in my practice. Okay, all right. Good luck to you. Hello, Joyce. This is the eye Dr. Ross. I have a similar symptom profile as Kathy Hill with sinus issues. When I have a flare up, my sinuses go crazy. And like you mentioned, I live with constant postnasal drip. This is for your info only, as I think there are more people with sinus irritation from Lyme and co-infections than most doctors think. Thank you for your time and your insight. Most appreciated. Maybe you can let her know she is not alone. All right. Well, Joyce, I just shared that. So very good. Good luck to you. All right. This is from Diane Meyer. She says, this may be helpful for Kathy Hill. Over the past 40 plus years working as a dental hygienist, I have seen dental pain from clenching during the night and night grinding the teeth at night. I noticed this happening in myself as my Lyme symptoms became worse over the years. There is no feedback in our nervous system tell us we are putting pressure on our teeth, so no one is aware of that happening. Stresses in our body, like illness, cause this pressure on the teeth to increase. Pain is the most common cause of clenching and grinding. I've seen hundreds of people over the years get dramatic relief from tooth pain by wearing a custom-made night guard, which is made by a dentist. I wear a night guard every night and no longer having tooth pain. There you go. So thanks, Diane. Thank you for sharing that. And so, yeah, Kathy, I hope you heard that as well too. All right. Very good. Hello, Susan. See, so many tick-borne diseases are gram-negative. What do you suggest to use for gram-negative infections? Could they be cultured? It would depend on the specific infection, Susan. And in terms of whether tick-borne infections can be cultured, it is possible to culture Lyme, but extremely, extremely difficult. I believe the same with Bartonella, and I don't know about Babesia. So I'm afraid I'm not going to be a good response for you here. All right. Hello, Leva. Hello, doctor. I'm trying to detox mold. Real time came back with results of trichocethene 0.123, gliotoxin 2.703, and zearalenone 0.715. I started detox with charcoal 280 milligrams for 4 days and built up to 1,120 milligrams per day, then added bentonite clay, NaC, Saccharomyces boulardii. After 3 weeks, I started to have lung and chest pain. I stopped taking binders for 5 days and the pain disappeared. Then I took again, but just half serving charcoal once a day and few days of NaC 600 milligrams. Chest pain started again and was worse than the last time. I stopped before binders again. It took 2 weeks to get better. Why am I reacting worse every time? How can I solve it? How can I support my nervous system going through detox? Thank you so much for taking time to answer questions. You're welcome. So I don't know. I'm going to give you some things to think about, and you probably should be talking to a physician who can examine you about this too. So depending on your age, you may be at greater risk of heart chest pain than at other ages. All right. And I don't have that information from you right now. I am not aware of any of these binders that you're using leading to chest pain. It would not be typical reaction that I would see. Okay. There is a rule of medicine that I have, though. I call it the Marty Ross MD rule of medicine. And that is that anything can happen to anyone with anything, which means that there can be very atypical side effects that we have that are not seen in other people. They're unique to us. Okay. And in a situation like this, if you see your doctor and they don't think you're having a heart problem, then I would want to examine you also to make sure that when you're having the chest pain, are you getting pain in the chest joints, so that the where your sternum meets your ribs, that's called the costochondral margin. If you are having excess cytokines caused by binding, the cytokines could be leading to inflammation in your joints, and maybe that's what your chest pain is, meaning maybe you're being too aggressive. Okay. So I would want to make sure it's not your heart. I would want to make sure that there isn't arthritic changes happening here, all right, as part of my evaluation. But let's say those are all fine. Then what I would do, because this is so atypical, is I would try to work with one binder at a time, start it, see if you tolerate it without chest pain. And if you do, then you probably aren't having a problem with that. Then add a second one in. And if you develop chest pain on that, then that's the one I would not use again. You may be having an atypical side effect reaction to that one. Then proceed with adding another one in. Okay. So you're going to have to do a trial and error on this, but given you have chest pain, I always want to make sure there's a doctor that evaluates you for that and looks for non-mold toxin side effect causes of the chest pain. Okay. All right. Good luck to you. Hello, Leva Agency. What is your opinion on steam room to detox? So anything that leads you to heat up can move toxins out of the body, okay? So heating, whether it's an infrared sauna, whether it's a hot steam room, whether it's a hot bath, whether it's going out and exercising and getting hot, anything that heats you up is going to help move toxins in the body. Now, those toxins that get mobilized out of your tissues move into the bloodstream. And from there, there's two things that can happen to them. One, they can actually be sweated out, or two, they go to the liver and the liver changes them from a fat-soluble toxin into a water-soluble toxin. And then as a water-soluble toxin, the liver moves those into the gallbladder and the bile duct, and then eventually out into the intestines. And if they're water soluble, they mix in our poop and we poop them out. All right. In terms of ratios, the majority of toxins that come out of you by heating up is not through your sweat. 80% of those toxins that come out of you by heating up go to the liver, get processed by the liver, and moved out into the intestines. Okay. But you can get 20% that come out in your sweat. All right. So any type of heating can do that. So could a steam room do that if you're getting hot? Yeah, steam room can help you with some of that detox. All right. All right. Thanks for that question. Hello, Nancy. Let's see. Newly diagnosed for Lyme here. Originally prescribed doxycycline for 2 weeks. Nurse practitioner that I saw at a Lyme wellness center extended it for 8 weeks. Is that long enough? Too long? So, the guidelines that I look, I follow recommendations of the International Lyme and Associated Disease Society on what to do with an acute tick bite. Okay, and this isn't an acute tick bite. Well, let me talk about acute tick bite and then I'll talk about your situation, right? So if you have an acute tick bite and you don't have symptoms, you just had a tick attached and you're concerned you might get Lyme, especially if you're in an area where there is a lot of Lyme, like out in the Northeast, the upper Midwest, areas where there's a high prevalence of Lyme. In those situations, I'd like to give doxycycline for at least 20 days. And that using doxycycline for at least 20 days in no settings is supported by studies in mice that show that mice that get bit by ticks and Lyme is transmitted to them, that 20 days of doxycycline will eradicate that Lyme. Okay, so these are based on mouse studies. There's no human studies, all right? We know, though, that in people that either get a bullseye rash when they get their tick bite, or within a week or two start getting very flu-like symptoms, fatigue, joint pain, muscle aches, that 3 weeks does not appear to be long enough. And in those people, the recommendation are people that have a bullseye rash after a tick bite, or associated near the time of a tick bite, develop a lot of muscle pain, fatigue, difficulty thinking. We recommend, ILADS recommends, and I agree, doing 6 to 8 weeks of doxycycline. Okay? All right. Now, I don't know how long you've had Lyme because you didn't mention anything about a tick bite here. What I will let you know is if you're diagnosed with Lyme and you have symptoms, that at a minimum, I would try 8 weeks. If that doesn't work, you're going to need to start figuring out, did you have other infections that got transmitted by the tick when you picked up your Lyme? And so those other infections could be Bartonella, could be Babesia, could be something called Ehrlichia, could be something called Anaplasma. Now, Ehrlichia and Anaplasma are easy to get rid of with at least 2 weeks of doxycycline. Babesia and Bartonella, though, require longer, and doxycycline alone isn't going to be enough to get rid of them. Okay? All right. So I hope that gives you some useful information there. Okay? All right. Thanks, Nancy. Good luck to you. Hello, Greg. Let's see. Hi, Dr. Marty Ross. What is the dosage and duration for cryptolepis in Japanese knotweed? Also, do you telehealth appointments and does insurance? Okay. So, Greg, I stopped doing clinical practice back in May. And I basically decided just to focus on educating people. I also have set up a whole online support community called Lyme United. I'll show you that to you here in a minute. But I'm no longer doing direct clinical care. After doing it for nearly 20 years focused on Lyme disease, I decided it was time for a change. Okay. So I can't help you in that way. If you are looking for doctors, you can go to ilads.org, their contact page. There is a way through that contact page you can request who ILADS members are in your area. ILADS is the International Lyme Associated Disease Society. Now, they don't all work the way I do, but there's a number of people there that do work the way I do. Okay. All right. So that would be an option for you to consider too. And then in terms of cryptolepis and Japanese knotweed, it depends on what you're treating. So an average length of a Bartonella treatment, which you could use those for, is going to be about 6 months. And about 80% of the time, you can knock out Bartonella with 6 months of treatment. All right. Babesia, which the cryptolepis can help with, the Japanese knotweed won't help with, often is about a 5-month treatment. And that's, you make a decision if you're done based on your symptoms. Did your Babesia symptoms go away? For Bartonella, you decide if you're done by looking at your Bartonella symptoms and did your Bartonella symptoms go away? All right. Lyme, on the other hand, takes longer. It is more slowly replicating. It grows a lot slower than Bartonella and Babesia do. And therefore, it can take longer to get over. And average duration of treatment once you have chronic Lyme can be 1 to 2 years on average. And that is based on my own experience, but also an organization called My Lyme Data out of California has 16,000 people with Lyme that have signed up, and periodically information be gathered about them. And based on a study they did 3 years ago now, they asked people, basically the question was they were looking at is, what got you well? What did it take to get you well? And in that study, what they found, and they asked people, what did you use? All right. So people could have talked about using Rife machines, ozone. They could talk about anything. All right. But what the data showed is that the things that work to get somebody well are a year or more of antibiotics, and that could be herbal antibiotics. Okay. Working with a Lyme literate physician, because working with somebody that has experience can help weave you through it. Okay. And then the third thing is using antibiotics, not using Rife machines, not using ozone. It was killing the germs with antibiotics. Now, in their study, they did not ask if people had benefit from herbal antibiotics. We can't tell. And I think that herbal antibiotics can help people get well too. But for Lyme, chronic Lyme, if you've had it for a while, a year to 2 years of treatment. Okay. Right. Hope that answers your question there. So let me just do a quick screen share here for you too. All right, so this back to my Lyme information site. So if you're looking for that information about the Lyme or the my Lyme data, take a look at this article. It's called What Works. Actually, let me click on it. It's called What Works, Navigating Prescription and Alternative Medicine Lyme Treatments, okay? And in here, I review a lot of the Lyme data information, and it includes information about how long, okay? All right. Oh, one other thing as long as I'm here. So I mentioned earlier that the other thing I'm doing is I've started a community for people living with Lyme. It's called Lyme United. We have now been open and operating for about 2 months. We had an initial beta group of testers that they're wrapping up 2 months. And about 3 weeks ago, I opened it up for anyone. Okay. So this is a group where I'm supporting people living with Lyme. This is kind of like a Facebook group. We don't host it on Facebook because I have problems with Facebook. What makes my group different than a Facebook group, though, is there's a physician supporting it. So I give physician input, and then we have a very active community of members here, people living with Lyme that are also adding a lot of insight and good ideas to people too. So inside Lyme United, we have a number of spaces. Let me just show you those. So this is what our Lyme United site actually looks like. What I was showing you here is the page that describes it, and from this page, you can actually sign up for it as well too, okay? But inside Lyme United, we have various places that people can interact, and I'll just point out a few of them. So we have one space which is called Member to Member, and this is a forum where people living with the illness can request help from others. They can request emotional help. They can request help trying to figure out where to get a certain product, what's the best thing to treat Bartonella. So members do their own input here. I don't usually give a lot of input here other than to overlook, see what's going on. And if it's something that's not safe, I let members know that too, okay? The other major forum we have is one where people can introduce themselves so that we can all welcome them here. It's quite an active area. We have another forum where people can share their wins, what's working, and then we all learn from what's working. There's another forum called Office Hours with Marty Ross MD, and in this forum, I respond to written questions that people submit, and I spend an hour Monday to Friday, 1 hour each day, writing responses to as many questions as I can get through in an hour. All right. Another forum we have called Ask Marty Ross MD Live, and this is a webinar that we host on Zoom. And because it's on Zoom, I get to actually ask people questions back. And what it has evolved into is I usually wind up spending time discussing with 2 people each week questions they have about their illness, and then everyone can learn from what my responses are there. And it's quite an involved group, so it's pretty good. And then recently, we set up another space called Unity's Take Charge, and this is where our members can host events. And so we're getting a number of members that are starting to host their own events here. So this is very much a member-driven forum that's supported by physician. So it gives a lot of best of all worlds, basically. Okay, all right. So you might want to take a look at this as a way of getting some help as well too. And we are open for new members at this point. All right. Thanks for that question, Greg. All right, everyone. Believe it or not, we had I had about 2/3 of the normal people that sign up for the webinar sign up tonight. And I don't know why. It's odd. Normally I have about 200 people that will sign up for this thing each week. And this time we had about 125 people sign up. So because we don't have as many people that signed up, I don't have as many questions tonight. And believe it or not, I've gone through all my questions. So I was going to say, if you have questions, feel free to go ahead and write them to me. Otherwise, we're going to wrap it up for tonight. We've got about 17 more minutes I can spend with you. But if you don't have any other questions, we'll go ahead and close it up here tonight. And then I got to figure out, where did everyone go? Why did we not have as many people show up tonight? So anyhow, I'll look at that later. Huh. Oh, I see. So Susan says, you said you were having shoulder surgery. I did. I guess I confused everyone at the last webinar. I said that I was going to have shoulder surgery and then I would not host a webinar tonight. But I still sent out a notice saying that I decided to have it. And so my shoulder surgery is actually tomorrow. So I decided I would spend my last evening before shoulder surgery with you all, and because I enjoy doing this. But I understand what the confusion is. Thank you for reminding me of that, Susan. Yeah. All right, let's see what we can do. There's a few more questions that just came through. Let's see. How long does it take to get better from Bartonella? So if you're on a Bartonella treatment, so as I was mentioning earlier, Bartonella replicates pretty quickly. So it replicates about every 24 hours compared to Lyme, which replicates about every 4 weeks, maybe every 8 weeks. And so people in a Bartonella treatment tend to respond more quickly if you're on the right things. All right. So generally, if you're on a treatment for Bartonella and it's working, that is effective, within 1 to 2 months of starting on those things, you should start seeing some decrease in the symptoms that we say are Bartonella symptoms, okay? So the symptoms that you could follow that indicate Bartonella are pain on the soles of the feet, neurologic agitation like seizures, tremors, bad anxiety, depression, air hunger, very bad problems thinking. And you follow those symptoms and you see if they're starting to get better. And if they are by 1 to 2 months, then you stay on the same things you're on and you treat for about 6 months or until your symptoms are gone. Okay. But usually by 6 months, 80% of the time treatment will be done. But you do want to start seeing improvement in those symptoms by 2 months. And if you don't, then you need to change to something else. Okay. All right. Thanks for that question. Hello, Deb. Let's see. What is the benefit of transfer factor plasmic and L+? So transfer factors. So there's 2 products made by a company called Research Nutritionals. One is called transfer factor plasmic, and another one is called transfer factor L+. Okay. So what transfer factors are is they are certain types of proteins that are made by a type of white blood cells. And I kind of, for this discussion, I like to describe it as with your white blood cells, there's a group of white blood cells that I call the detectives. They figure out if there's an infection there. And then there's the army, the group of white blood cells that are going to go in and attack. Okay. So the detectives can detect, is there an infection? And they can even detect, is it a Bartonella? Is it a Babesia? Is it a cold virus? Is it COVID? And what they do is they manufacture these chemicals called transfer factors. All right. And those transfer factors help turn on the white blood cells, the army, to bring the right equipment to fight that type of infection. And in addition, these transfer factors bind to the germs, letting the army know that these are the germs that they got to attack. Okay. So it's a way of stimulating the immune system to fight those specific germs. Transfer factor plasmic by Research Nutritionals has in it a number of transfer factors that are intended, or that are transfer factors against various viruses. Transfer factor L+ has in it transfer factors against most of the Lyme and tick-borne infections. In addition, I think HHV6, if I'm right, cytomegalovirus, and I believe mycoplasma pneumoniae. Here, let's go look together. I'm going to do a quick screen share here. The reason I just looked up, my house is the trees are starting to beat up against my house. So I think we're starting to get a storm moving in here. Let's see here. All right, so let's go over here. So let's look at transfer factor plasmic. All right, so here's transfer factor plasmic. And in terms of down here, I talk about what these transfer factors are supposed to target. So the transfer factor plasmic has transfer factors in it against Borrelia, which is Lyme, EBV, HHV6, cytomegalovirus, chlamydia pneumoniae, pneumocystis carinii, tuberculosis, herpes type 1, herpes type 2, that's cold sores and sexual herpes, everyone, cryptosporidium, Mycobacterium avium, hepatitis A, B, and C, staph, strep, E. coli, parvovirus B19, varicella zoster, which is Epstein-Barr virus, monovirus, candida, mumps, measles, and rubella, mycoplasma, ureaplasma, nanobacterium, and human papilloma viruses. Okay, so there's some bacteria thrown in here too, but generally this is what I would use if I've got people that I think have activated chronic virus infections. This is the transfer factor I might use for that. And then in terms of the transfer factor L+, again, it targets most of the tick-borne infections and a few viruses. Let's look at what those are again. So the transfer factor targets Borrelia, Bartonella, Babesia, Ehrlichia, Epstein-Barr virus, human herpes virus type 6, cytomegalovirus, and chlamydia pneumoniae. Okay, so those are the things that it's designed to target to. All right. So the other part of that question is, do they help? And I think it's a mixed bag. Where I tend, back here. So when I have at one time added it into most of my treatments to see if I was getting benefit, and I wasn't overwhelmed by the benefit. All right. Where I have found benefit, though, is if I've got a patient that has some obvious signs of immune suppression. They're the people that tend to get every virus that comes along during cold and flu season, for instance. I find benefit from using the plasmic in those situations. In terms of when to use an L+, I've tended to use it in situations where we have to pull people off of their Lyme antibiotics, either herbal or prescriptions, because they're getting repeat yeast infections. And I want to do something to help their immune system keep those germs at bay while I've got them off of their antibiotics. And I've used it in those situations, I think, with some success as well, too. Okay. All right. Thanks for that question, Deb. Hello, Sandy. Let's see. Any comment on Bart sores and how to get rid of the sores? No specific. So Bartonella can give you stretch mark rash, as many of you know, but also Bartonella can give you these little papules or red bumps. The only thing I have found that gets rid of those is to treat the Bartonella, not the skin itself, but rather the Bartonella. Okay. And that, using your herbal or prescription antibiotics for that. Okay. All right. Thanks, Sandy. Good luck to you. Hi, Cheryl. Let's see. What do you think about the need to treat parasites before treating Lyme? So let me talk about parasites. So there is a theory that has been supported by a physician out in Seattle, Washington, Dr. Klinghardt, who thinks that chronic Lyme, people with chronic Lyme have chronic parasite infections living inside the body. All right. But there is no science, valid science, that actually supports that. So there is that theory. Okay, so there are some people trained by Dr. Klinghardt that read his stuff that think, gosh, we got to go in and kill parasites before we start killing Lyme. And what I will let you know is I don't think it's valid. I've gotten all kinds of people well with ever doing anything for parasites. And in fact, I rarely do anything for parasites in my practice. The people that I have done things for parasites are people that have the possibility of intestinal parasites, not parasites living in their bloodstream or their eyeballs or wherever people think parasites live, but intestinal parasites, okay? And the people that I think about intestinal parasites in are people that have a lot of gastrointestinal problems like cramping, diarrhea, and that they're coming in with that at the beginning of treatment. And I look to see, do they have too many yeast? And if we treat yeast and they don't get better, then I start wondering, are those GI symptoms coming from too many parasites living in their intestines, right? And the people that I'm going to really be suspicious and look for it in are people that also have risk factors of getting intestinal parasites. And so these would be people that have drank a lot of well water before. Even if the head of the well has been tested and it's safe, it's still possible they've missed it, okay? People that have camped without treating their water and they drank water that might have parasites in it. And then people that have traveled to less developed areas of the world and have gotten gastrointestinal symptoms while they're there and never got it treated for possible parasites, all right? So those are people that I might start thinking about parasites. Now, I will look at their stool. I have stool studies done to see are there parasites. And if they do, then I'll use those stool studies to guide me as to the best agent to use to treat their specific type of parasites. But if I do those stool studies and they come back negative and I still have a high suspicion they might have parasites because of where they've been and their risk factors and continued GI symptoms, then I will empirically treat them with medicines to get rid of those parasites. And generally what I'll use is a medicine called Alinea. It's a prescription medicine. And I'll put them on it for 3 weeks. The reason I choose Alinea is kind of the shotgun, if you will, of parasite medicines. It can treat a broad range of parasites. And so if I can't identify in a stool test what the parasites are, and I have high suspicion there still may be parasites there based on symptoms and where a person has been and type of water they've drank, etc., then I'll use Alinea. And I've gotten a number of people well doing that, okay? Do I do that at the beginning of treatment? Sometimes I let the history guide me. If somebody tells me they were doing great with their health and then they went to Mexico and since then nothing has been the same and they got a bad diarrhea infection when they were there, even if they come in carrying a positive Lyme test, I'm going to start by cleaning up their gut first. So a positive Lyme test does not prove you have Lyme in you now, because generally we're measuring immune system reactions that will remain positive even if the immune system got the germ out, all right? So I let the history guide me as to whether I'm going to treat parasites first or not, okay? All right. I hope that gives you some useful information there. Let me just do a quick screen share and show you my parasite article. So take a look. This article called When and How to Treat Parasites in Lyme Disease, okay? Where I basically, everything I just described to you, I describe here in this article, all right? Thanks for the question, Cheryl. Thanks, Joyce. Joyce gave me good wishes for my surgery tomorrow. I appreciate that. Margaret says, my nose constantly runs. I even had ear flooding. Antihistamines have only a minor effect. What on earth can I do? So I would start by looking to see what's going on in your intestines. And if you have the possibility of intestinal yeast overgrowth, I would treat for that. And again, what that has to do with runny nose is you have immune cells that line your intestines that will react against the yeast, releasing histamines that go up to your nose and cause your nose to be leaky, like you have allergies, basically. All right. And I have seen situations where I treat for chronic intestinal yeast overgrowth, and we treat the yeast and people's nasal problems go away. All right. There is also a type of runny nose that is called vasomotor rhinorrhea or runny nose. And it's one where we think there's problems with the blood vessels themselves just being too leaky, and they're leaking liquid out. That and that is something an ear, nose, and throat doctor can help you with. They're going to use medications that can constrict the blood vessels from leaking as much. That is a more difficult condition to treat, though. Okay, so but I would look and see, do you have yeast? I showed you earlier tonight the article that you can look at. You can go to my yeast chapter in my Lyme guide. The article is called A Silent Problem, Do You Have Yeast? Look through that article. I describe how you can figure out if you have too many yeast in the intestines, and if you do, treat it. Okay, all right. Good luck to you, Margaret. Hello, Dinah. Dinah says, do you recommend HLA testing? Generally, I don't. HLA testing is a way of looking at genetics related to whether you are a person that might get mold toxicity or not. And this is something that Dr. Richie Shoemaker came up with. Dr. Shoemaker is the first doctor that really described that people can have mold toxicity. And he found certain patterns on your genetic profile on an HLA-DA genetic profile that would occur in people that have mold toxicity problems, all right? What I have found by using his testing is that having a pattern of mold toxicity does not prove a person actually has mold toxicity causing their problems. And secondly, I've had a number of people that have had very terrible mold toxicity, and their HLA patterns do not suggest they would have the problem. So I don't think the science is that good, is always accurate, okay? And so what I prefer to do to figure out if somebody has mold toxicity is not look at their genetic profile, which only says whether you have a predisposition for the problem, but actually look and see, do you have the problem? And so I like using urine test to see if the mold toxins are actually in excess in you, okay? All right. And that test I like using these days is something called real-time labs, all right? All right. Thanks for that question, Dinah. Thanks, Diane. Diane says, good luck. I appreciate that, Diane. All right, everyone, that's it. So good to be with you here tonight. And thank you for all you that showed up. I guess I did send conflicting signals out last week. And thanks to everyone and your good wishes here. I appreciate that. So take a look at your email tomorrow morning, somewhere between 9 and 9:30 a.m. I hope to have this done. Surgery's in the afternoon, so I do have time in the morning to fuss around with this a little bit. And when you get that email, there'll be an opportunity to sign up for next week's webinar as well, too. All right. You may see me a little bandaged up next week, but I'm looking forward to getting my shoulder operated on so I can get back to exercising again. So this will be good. All right. Good night, everyone. And have a good week.